in.
Hi, I'm Gabe, and I'm the respiratory therapist here, and I was ordered to give some oxygen therapy to you because it looks like you are having some difficulty breathing.
Okay.
Alright, it shouldn't take me too long to apply, 10 to 20 minutes. And before we do anything further, I'm going to need some verification for identification.
Okay.
So can you please give me your full name and date of birth?
Homer Simpson, 5/12/65.
Okay, cool. And I'm going to see your medical ID bracelet here. Okay.
You see the ID band says 66762.
Okay, got it. And then I'd mark that down if this was here. Okay. 662. Okay, thank you very much. Okay, so it seems like you're having some difficulty breathing. How are you feeling?
Yeah, I've been better. I feel like something's acting up in there.
Okay. Well, I think I have a device here that should be helpful.
Okay.
Do I say the device?
You can say the device.
Okay. So in this situation, I'm going to be going with the simple mask.
Okay.
Hi. So I have the device that I plan to apply right here, and right before I apply it, I need to make sure that you are in the situation that it says you are on this paperwork. So I'm going to be collecting your vitals. That's
Okay,
with
sounds
you.
good.
Okay.
Good. Made me a little nervous. I thought you were trying to deliver therapy prior to getting
No,
vitals.
no.
So for the sake of
I'm gonna explain this after the
going
vitals.
through this space, you can at this point tell me what you're trying to educate me on, and if you need to grab the device, that's perfectly fine. But please, guys, don't forget to get your pre-vitals before implementation of therapy. So what do you want me to do?
Okay. So can I see your finger?
Sure.
Okay. Cool. Thank you. Hey. It's the old school one. So I need to make sure that the light is going to be on top. My hands are a little cold. Dr. Hands, sorry.
Dr. Gabe.
Okay, and I'm also going to be checking your pulse on your
Okay.
wrist, please. Thank you. And this is on there correctly. Just double checking that. All right. Sitting around 74. So pulse.
And what Gabe's gonna have in front of him is the sheet of paper to make note of what that heart rate was when he got it, to make note of breath sounds when he got it. I'm going to just show me on yourself where you would get those breath sounds, and then I'll let you actually do it in competency.
Okay. Breath sounds for this particular patient is going to be right below the clavicle, both sides, slightly below that, and mid-axillary, and on the back is going to be like.
But I would assume that you're gonna place it in an appropriate spot, kind of laterally on me, sorry,
Should I grab the
posterior.
stethoscope really quick?
No, you're okay.
good.
Saw that, that's fine. You just kind of got shunned into this space at the last moment there.
Okay, good.
So at this point, he'll have gotten my breath sounds. Are you complete in your vitals assessment?
Nope, I'm about to. Okay, I'm going to be back here getting some respirations. Yeah, I know, I should have said that. Here we go.
Okay.
Lower side.
Very good.
No, normal. Yeah, normal.
So Gabe's opting to do a 30-second interval, in case you guys were wondering, and he's opting to do the breath sounds and respiratory rate assessment. So usually when I teach you guys, it's heart rate, and then pretend like you're still doing heart rate. So either method is fine as long as you're getting an appropriate value that makes sense to me, the patient. I know how I breathe. I know what my heart rate normally is, so I'll be checking that against the machine. So all vitals obtained so far, so good.
Do you have any production when you're coughing, any kind of sputum?
Yeah, actually, I've been coughing up like small, thin, white
Okay.
stuff. Yeah.
Okay.
And then he'll make note of that as well, because we'll have the documentation space to do that for me. Okay. Now that all vitals have been obtained for pre-assessment, what would you want to do at this point?
Okay. It depends on what their vitals are and if their vitals are indeed what is presented.
Yes, so every vital that you noted for myself is the same for Homer Simpson, but we're gonna pretend like my saturation is actually 80-30% for the scenario.
Okay. All right, so it looks like you are indeed having some difficulty breathing. This device I have with me right now is known as a simple mask, and what it is, it's going to be delivering some oxygen to you in a way that, the way that you're breathing right now and the situation that you're post-op, it should support your breathing
Okay.
a lot better than some of the other devices. So.
Oh, okay, that makes sense, thank you.
Mhm.
And then at this point, you can place the therapy on the mat again, please.
Okay.
And your throat tube is right there, kind of nose.
Or two. Oh, okay, yeah. It's a little tangled up. That's a lot tangled up. Okay. Yay. All right, so since we are at 80,
83.
since we're at 83, and this can go 5 to 10, I'm probably gonna put this 83, I'd probably put this at around 7, I would say, since the lowest can be 5. So I'd say I'm gonna be even more moderate and put it at 6,
Okay.
just to see, slowly titrate up.
Because you're my guinea pig, I'm gonna call it out. But what should he have done before he plugged in his oxygen? Check for flow acceptance before we plug in our device. But otherwise, yes, we're getting that flow running before it goes on the patient, which is also good to see.
Okay, ma'am, you're gonna feel a bit of cold air on your face, and if you have any more discomfort in regards to that, please let me know,
Okay.
and I can adjust things. Move your head forward, please, a little bit.
I can't. I'm in so much pain.
Oh, that's okay, I got it, I'll work around you, don't worry, don't move. Okay, there you go.
Oh, wow, that's nice, thank you.
That's a lot better?
Mhm.
Okay, I hope so, thank you for cooperating and letting me know what's going
I
on.
appreciate it. This feels really good.
Okay, good. Just to double check to see how you're doing in regards to this intervention, I'm gonna get another set of vitals, if that's okay with you.
So what does deter a student sometimes is I will say, oh wow, I feel so much better, thank you. And then you guys are like, yay, thank you. All right, so have a wonderful day. And then you're like ready to get out of there. So do not trust just the subjective information. Gabe's correct in saying, okay, well, thank you for that information. I'm gonna assess that by getting your post vitals now. So I'll just give you those verbal post vitals since you did a good job checking the vitals on the first try. Heart rate we'll say now is 79. Respirations now are 18. Your SpO2 now is 95%. And your breath sounds are the same with speed of the same. How do you feel about these vitals?
I like it a lot. Obviously, it's a big improvement. 95, where normal ranges for normal SpO2. I would say I could give a little more. It probably wouldn't hurt, but at this point, I think we're all right.
Okay, so we're gonna leave therapy as is?
Yes, we're gonna leave therapy as is,
Okay,
and I'm
so
gonna
go ahead and
say.
show me what you would say to a patient as you're getting ready to exit the room now.
Okay, looks like everything is doing good with your vitals. This seems to be helping a whole lot more. And as for orders, I'm going to be showing up as needed as per doctor's order, so you will probably see me again. And you're also going to be seeing the nurses and the doctors, so if you have any questions, you can ask any of us, but I'm here right now, so if you have any questions or concerns, I'm right here.
That's great. No, I'm okay. Thank you for letting me know.
Okay.
But I guess I'm
Okay.
wondering, how long do I have to wear this thing?
So right now, this thing is seems to be improving your status.
Shoulder.
So,
So compassionate.
Continue, sorry.
it's called business casual. Business casual intimacy. Let's do that. Yeah. So this current device is really improving your status at the moment. So likely, as you are improved with other treatments that the doctors and nurses are going to bring, your status is going to get pretty normal. So you're going to eventually take this off when that happens. So it's probably going to be until then. At this moment, it's just going to stay on for a bit until that's treated.
All right, that's fair. Well, thank you.
Thank you very much.
And Gabe gets to doff his gloves and give me his little paper that he took all his notes on, and he's probably gonna get a pretty good score on that one too.